We've all experienced occasional stomach troubles, but for some people it's a chronic condition, even an autoimmune disease, one of which is Crohn's disease. Here's the latest in this week's Positively Healthy. Bowel issues are a common subject that many people are reluctant to discuss, but identifying and treating problems early may save a heap of hurt in the long run.
So one of the important things for us is to try to identify patients with Crohn's disease early on, because oftentimes patients go a long time with symptoms before they're ever actually identified properly as having Crohn's disease.
Dr. Michael Crohn is a gastroenterologist with Physicians Regional Medical Group. He explains that Crohn's disease is one of several conditions that affect the digestive system. It's often mistaken for other inflammatory bowel disorders, and symptoms may overlap.
One of the major differences between ulcerative colitis and Crohn's disease is that ulcerative colitis involves only the colon, whereas Crohn's disease can involve anywhere in the intestinal tract. If it involves the colon, Crohn's disease may have very similar features to ulcerative colitis, such as diarrhea, rectal bleeding, lower abdominal crampy pain. Whereas if it involves primarily the small intestine, Crohn's disease may present more with abdominal pain without the diarrhea feature.
Doctors aren't certain what causes the disease, but the body's immune response kicks into overdrive, triggering an inflammatory sequence.
It's a big cascade of various chemicals that are involved in the immune response and lead to inflammation. And this inflammation manifests itself oftentimes as what we would almost consider like canker sores of the bowel.
There is no cure at this point for Crohn's, but major strides are helping patients better manage the condition.
So there are a wide variety of drugs. There are drugs that we call biologics, and at the moment, biologics are only administered either through infusions through an intravenous line or self-injections, like a diabetic would give themselves insulin. There are other drugs called immunomodulators, which are available in pill form, and we often use the two, and it's really revolutionized the treatment.
Interrupting the inflammatory process calms the storm within, lessening the likelihood of serious complications and giving Crohn's patients good quality of life.
We may keep them on the medications long term, again, to help prevent relapses and prevent organ damage to the bowel.